Hi and welcome. I'm Jay, and today we're covering newborn care essentials. The basics you need to know to feel confident caring for your baby in these first few weeks. The newborn stage can feel overwhelming, but remember, babies are simple and their needs boil down to feeding, sleeping, comfort, and hygiene. Let's break down the key areas of newborn care so you feel prepared. Diapering basics. There's a lot. Newborns go through 8 to 12 diapers a day. That's a lot of changes, but here's what to expect. Wet diapers, expect about 6 or more per day once your baby is feeding well. This shows good hydration. So if you're ever unsure while you're breastfeeding, does my baby have enough? Are they getting enough? You will know if they are peeing 6 times a day. Poop changes. Newborn poop starts as this thick black substance called meconium. And it eventually transitions to mustard yellow if your baby's breastfed, or a firmer darker brown if your baby is formula fed or combo fed. Diaper rash prevention is something else that you really need to consider. You have to change babies' diapers very often and allow air time for them to air out. Don't forget to use a gentle barrier cream as a preventative measure rather than waiting for after the baby has start showing signs of diaper rash. If you notice fewer wet diapers or very pale poop, you need to check in with your pediatrician immediately. Newborn bathing and skincare. So, the first bath, we are going to say sponge baths only until their umbilical cord has dried up and fallen out. And that can be anywhere between 1 to 2 weeks. Once the baby is ready for a tub bath, you're going to want to use lukewarm water, mild baby soap, and wash gently. Newborns don't get very dirty, and you don't have to wash them very often. Then you have this thing you got to be on the lookout for called cradle cap and other dry skin. Cradle cap, as gross as it looks, is actually normal. A little bit of coconut oil on your baby's scalp or baby lotion can help, but you want to avoid any harsh products and don't pick the cradle cap out. That can lead to infection. You want to bathe your baby anywhere from 2 to 3 times a week. That's enough. Too much baths can dry out their skin. Their skin's super sensitive when they're first born. Okay? Now, when it comes to safe sleep and soothing, newborns sleep anywhere from 14 to 17 hours a day, but in short cycles. So, if you want a safe sleep, your doctor and your provider, they're going to provide you further guidance, but you're going to want to place baby on their back on a flat, firm surface like a crib or a bassinet. No pillows, no blankets, and no stuffed animals. Anything, nothing with them in the crate, in the, whatever they're sleeping in. Then you want to practice swaddling them, and you can even use some white noise. The swaddling combined with the white noise can help mimic how they felt in the womb and just help them feel more secure and snuggled. Then you want to think about soothing. If your baby's a little bit fussy, you can try the 5 S's, which is swaddle them, side or stomach hold them while they're awake, shush them, swing them gently, and sucking, which is pacifier or nursing them. It's normal for newborns to wake very often. Their tummies need frequent feedings. Some doctors, some pediatricians might say you need to feed them only every 3 hours, but how would you feel if someone said you could only eat every 3 hours as an adult? You want to snack a little bit. You want to drink some water to hydrate. So just think about that when they wake up and you're not sure what they want. You can start with those 5 S's or trying to feed them. So let's talk about feeding basics. Newborns eat a lot, like up to 12 times a day, every 2 to 3 hours. Sometimes when they're cluster feeding, it seems like every 30 to 45 minutes. So when it comes to breastfeeding, and we'll talk about this a little later down the road, you want to start looking for hunger cues like rooting, sucking on their hands, or fussing. A good latch in terms of breastfeeding is key to comfort. If you're formula feeding, you got to follow the package instructions on the back and always prepare bottles with clean hands. When you have to burp your baby, the baby needs to burp every few ounces or after each breast. So if you nurse on the left, bring your baby up and burp them slightly before you put them on the right. And it's not hard. It is a gentle pat on their back that will do the trick. And there's some other techniques that you can use as well that I can definitely talk about later or show you in person. If your baby's making a lot of wet diapers and gaining weight, and they're probably getting enough to eat. So you're probably doing a really great job in terms of feeding them. The newborn phase is a big adjustment, but with patience and practice, you'll get the hang of it. So trust yourself, follow your baby's cues, and don't hesitate to reach out if you need support. You're probably going to be doing an amazing job, and I'm here for you every step of the way. See you in the next video.